There is roughly 1 million people living with HIV in the U.S., and 1 in 7 of them don't even know it.
There's
This
only
video
one
reel will
catch, and that's plasmapheresis.
In 3 months since I announced the emergency plan, an estimated 760,000 people have died from AIDS.
Demonstration is the latest of many staged by the militant group ACT UP.
My name is Larry Bryant. I'm a married man here in Alexandria, Virginia, with a son and 2 stepdaughters. I was diagnosed HIV positive in 1986 when I was 18 years old, freshman in college at Norfolk State University. So I kept that secret, kept that to myself for the next, 5 years at least. I didn't tell anyone. And it was probably one of the most horrible, if not the most horrible span of time in my life. The thing that scared me most, more than my teammates or my classmates or the girl I was dating at the time, more than that, I didn't want to die somewhere in silence and my family find out through some article in the newspaper.
Larry learned of his HIV status during the early stages of the AIDS epidemic. In 1986, the CDC reported that AIDS was disproportionately impacting Blacks, African Americans, and Hispanic Latino Americans. This was also a time when misinformation ran rampant. The public worried that they could get infected through casual contact like shaking hands, sharing a drink, or using public restrooms. Widespread anxiety that the AIDS virus was easily transmissible fueled discrimination against marginalized communities. Today, medical advancements have turned HIV from a death sentence to a manageable chronic condition.
Yes, those misconceptions do still exist. HIV, AIDS is a disease that certain people deserve, that it's owned by one community or another, and the reality is HIV affects all of us. Unprotected sex, not getting tested, or not knowing your status are the 2 most common factors that help perpetuate the disease, but also access to care and all the other things that come with just being marginalized and not prioritized health-wise. Regardless of one's sexuality or gender, sex is sex. Unprotected sex is unprotected sex is unprotected sex, regardless of who you are. So we shouldn't limit this condition to any specific group. HIV isn't looking for your sexual identity or your sexual preference. HIV is just looking for the opportunity for you to allow them in, or it in. And we as a community need to be more conscious about how we protect other humans.
Larry later revealed his condition to his family and went to Houston to join the ranks of AIDS advocates. It was then he realized he needed to practice what he preached by learning to take care of himself as a person living with HIV before talking to others. So he met with a physician for the first time on how to manage his care as a person living with HIV.
So it opened up a whole new understanding of how HIV works in my body, and that as humans, we have the opportunity, once we're diagnosed, to be able to apply the right kind of treatment and the right kind of medication and the steps forward to provide for full positive health outcomes. And again, had I not gotten tested, I wouldn't have known that. The thing that really gets to me is, had I not gotten tested, even by accident when I was at 18, my biggest fear was, again, not knowing and the possibility of me passing that virus on to others. And that scared the hell out of me. The good news is the girlfriend at the time I was dating did not acquire HIV. I had a son with her, Dominique, who is HIV negative, which is great. But again, since then, knowing my status afterwards made me far more confident about my ability to protect others. And I think that was my biggest thing at the time. And just that blank, because there was a lot of that dark time in those 5 years after my diagnosis that I just could have given up and just not cared. And I'm glad that whatever was in me driving me to be productive, to stay connected, to just not want to die. I think that's pretty much what it was. Just self-preservation, not wanting to die, feeling I am living within an unfinished life, and I want to see it through, whatever that means. Cross that bridge to 2002, get connected with the advocacy and the prevention work that I originally got involved in, and then learned as much as I could about kind of how people are impacted, and more importantly, how we can connect people to the services, resources, and health opportunities that we all can benefit from.